All right, we're going to do the skill now of dressing the client with an affected right arm. We've got 2 shirts here because this is our equipment we need to assemble is a choice of 2 shirts. So we're ready to go. It is the right arm that is affected. It will never be the left arm. The skill is dressing a client with an affected right arm. We always begin with our pre-procedure actions. So I'm going to knock, pause, and enter. Hello, Mr. Gibbs. My name is Ann, and I'll be dressing you. I know that you have an affected right arm. So I'll also do my peanut butter sandwich, which I do before and after each skill. Provide privacy. P. B is ensure the bed is low and it is locked. He's got his signal light. Let me find that. And wash my hands. So now I'm ready to begin the skill of dressing the client with an affected right arm. Remember on this skill, the critical step is that we remove the gown from the unaffected side, which is his left, first, and we apply the shirt to the affected side first, which is his right side. So I'm going to remove the gown from his left side first, and I'm going to apply the shirt to his right side first. Mr. Gibbs, which shirt would you like to wear today?
The green one.
So I've given him a choice of shirts, and he's chosen the green one. As I undress him, I'm going to make sure that his chest is covered. So we'll slip this off, keeping the sheet pulled up. So I've slipped the gown off, and I'm going to put it straight into the dirty linen cart. Now I'm going to go ahead and put his green shirt on. Remember, I did remove the gown from the left side first. Now I'm going to apply the shirt to the right side first. So let's go ahead and put your right arm in. All right, will you hold this sheet up, please, Mr. Gibbs, and then go ahead and sit up. All right, we can have our fellow student who's in the bed for us help us with this particular part of the skill. Go ahead and slip your arm in there because that's his good arm and he's able to slip that arm in. All right, you can lay back down, and we always keep the chest covered as we slip that shirt on. So we're going to finish with the clothing in place, and we do not have to button it. Our nurse evaluator will let us know that we do not have to button it. So we've now completed the skill. What we want to do now is we want to make sure that we remember the critical step is removing the gown from the left first and applying the shirt to the right first. I have my students to remember it as left, right, and then right, left. I also use objects in the room to help them remember it. So you can use those steps as well to help you remember. For instance, in this room, they undress the cabinet first and they dress the wall first. So you can find something in your environment to help you remember this, as I've had a lot of students in the past get their lefts and rights mixed up when their client is laying in the bed. So now we're going to do our post-procedure actions, which are remove privacy, P, peanut butter sandwich, B, ensure the bed is low and it is locked. S, we're going to give you your signal light. Here you go. And W, we're going to wash our hands. And that concludes the skill, dressing the client with the affected right arm.